So I think it has to do with anything when you're creating something larger from something smaller. So as integrated cancer care teams, it's really part of a paradigm shift. So the cancer care team of the old ways, and that for some people might have been last year or it might have been 20 years ago, was the team of, here's my discipline, whether it's medical oncology or radiation oncology or navigation or nurses, this is what I do and this is my role and responsibility. Now that we're really focused on integrated cancer care teams, it's how do I do my job in correlation or correspondence or collaboratively with the rest of all the other work that's going on. So I think one of the first parts is how do I think about this new paradigm shift, right? How do I work really as part of a team? So how do we think about that? I think the other thing that we think about that's a challenge is resources and time, or time resources. Anytime you build something new, you have to take time to do it. So it's, do I stop doing something else when I figure out how to do this in a new way? Or do I just take more time out of my day or my week to build this new way of doing things? And so I think that's the biggest challenge, is the time. And the other thing that's a challenge is to really not adequately, but properly evaluate your own system in a realistic way to say, you know what, we really aren't very good at doing this. How are we going to do this better? Is that something that we can really do ourselves? Or is that something that we need help from someone on the outside to do with? Or is this something that we're really not going to do and we want to allocate this out to another resource to do for us? Ultimately, you're there to serve the patient. So when I say do for us, I mean doing for the patient. So I think those are probably the three biggest challenges. Time pressure, changing your paradigm shift, and really evaluating what you're good at and maybe what you need help from someone else to do.